I'm Anita Huberman. I'm the CEO of the Surrey Board of Trade, and thank you so much for spending some time with us on a Surrey Digital Town Hall. And today's session is focused on safe operations for the new normal. And we are so pleased to partner and welcome the CEO of the Manufacturing Safety Alliance, Lisa McGuire, and she'll be introduced more formally shortly. I'd like to acknowledge that we are on the unceded territory of the Coast Salish peoples, specifically the Kwantlen-Katzie, Semiahmoo, and Tawasin First Nations. I'd like to thank the Port of Vancouver for their ongoing sponsorship of the Surrey Digital Town Hall series since the pandemic started in the middle of March. Just a couple of instructions before we begin and some information. The session is being recorded. The link will be sent to you after the session is over. If you do have any questions, just put them in the chat function and we will get to them as soon as we can. If we're unable to answer your questions, we will get the answer for you after the session is over. And just a couple of things that I wanted to mention to you. The Surrey Board of Trade, we are one of 9 organizations as part of the BC Premier's Economic Recovery Task Force. And you are going to hear later in September a bit of BC's Economic Recovery Plan. And of course, it's fast moving, as is the situation concerning the pandemic. I'm also a member of the Surrey Economic Recovery Coalition, where we meet with the City of Surrey every 2 weeks to talk about gaps and opportunities related to the pandemic and post-pandemic. And that is in partnership with our local BIAs, a labor organization, the South Asian Business Association, and Chambers of Commerce. And I wanted to mention that we have a direct line into the Prime Minister's office to do the very same thing, to identify gaps and opportunities during and post the pandemic. And so now, ladies and gentlemen, it's my pleasure to welcome our partner in this event this morning, the CEO of the Manufacturing Safety Alliance, Lisa McGuire. Thank you so much for joining us, and over to you.
Thank you, Anita. It is a pleasure to be here and answer important questions to you and your members that I'm excited to be part of. The Manufacturing Safety Alliance of BC is a health and safety association serving the manufacturing industry. We provide health and safety support to help the industry be successful in putting in health and safety programs to protect their people.
Lisa, one of the things that I wanted to ask you, a question that we have been getting over and over again, is what are some workplace risk factors that can contribute to the transmission of COVID-19? We're in phase 3 of opening. We want phase 4 to happen. We want that curve to completely bend down. Can you talk about those risk factors, please?
Certainly. So to understand how workplace risk factors contribute to COVID-19 transmission, we need to have an understanding of coronaviruses and how they're transmitted. So coronaviruses is a large family of viruses found mostly in animals. In humans, they can cause diseases ranging from the common cold to more severe diseases such as SARS or MERS, where in 2003, the SARS epidemic affected 26 countries and resulted in more than 8,000 cases and 774 fatalities. MERS, first identified in 2012, globally more than 2,400 cases have been confirmed, and over a third of them got infected, died. So today, COVID-19, which is a new name for the virus that emerged in November of 2019, has impacted 16.8 million worldwide with over 660,000 deaths. So certainly recognizing that the primary form of transmission in COVID-19 is through droplet or fluid transmission. Although there is some debate in the scientific community that we're hearing and certainly has emerged on the potential for aerosol transmission, but really the controls that we're focused on are to prevent the fluid or primary droplet transmission, where the potential when a person coughs or sneezes or when they're talking in very close proximity to another person has the opportunity to enter through the eyes, nose, or the mouth, and with that has the opportunity to infect another individual. So I'll briefly share a bit of a visual on what this looks like in terms of, if you just give me a second, please. Looking at a graph, what happens at two meters when somebody coughs, we're really looking at controls that support that 2-meter parameter. So the relationship of the number of people, the distance between people, and the length of time that people spend together increases the risk of COVID-19 transmission. So when you look at this visual, we see squares of dark orange. So the higher the risk of putting those circumstances together, lots of people close together, spending longer times together increases your risk. So what we're doing by implementing controls is reducing those risks, and primarily through managing social distancing circumstances.
So Surrey has the greatest number of manufacturers, and the Manufacturing Safety Alliance, you represent all throughout British Columbia, over 3,000 manufacturers and food processors. Tell me about how those workplaces, and in general all workplaces, what steps should they take to reduce or eliminate transmission in the workplace?
So understanding how the virus is transmitted, looking at where physical distancing is the primary form, looking at how can we maintain that 6 feet or 2-meter distancing, looking at controlling the number of people within the workplace and the duration spent together. So looking at those 3 key areas of risk, and then where you can't meet those conditions, applying what's known as a hierarchy of controls. So looking at ways that we can manage those circumstances through putting in process controls or barriers to, or PPE as a last resort, as a way to support that maximum opportunity to reduce COVID-19 transmission. And I'll give you a brief opportunity to look at what I mean by the hierarchy of controls. It provides a visual representation so that you can see that. So when we're looking at that, this is the thinking that we put in putting in a program or a control COVID-19 safety plan. It's looking at ways where we can't manage that social distancing parameter of doing other things to support or to improve the opportunity to protect the people and prevent COVID-19 transmission.
Lisa, we know that for business leaders and owners and managers, we need to create safe operations for a new normal. This is not going to be the last pandemic or situation like this where we need to create a safe workplace. Please provide some advice on how the role of the business owner, the role of the business leader needs to really focus on creating a safe workplace.
Yes. So, I mean, first, we look at the compliance lens, the legal obligation. The Public Health Office has issued orders and requires the development of a COVID-19 safety plan, and to post that plan to your website if you have a website. And then, of course, WorkSafeBC ensures compliance of those safe operations. But beyond the compliance lens, what is really important, for businesses to adapt to this environment and thrive as opposed to survive, leadership is critical in terms of the role they play in ensuring the safety plan, that is adopted and implemented is integrated within their business operation, and starting by reflecting of where you are in looking at, what is your performance as a health and safety within your business, and looking at how do you move forward, ensuring that the behaviors within the workforce adopts those controls or changes to ensure that we maximize the reduction or transmission of COVID-19. Staying informed as business leaders and knowledgeable and know where to accurately obtain information. Establish regular, clear communication channels at all employee levels to provide updates and address existing and new areas of concerns that arise, all really important. And of course, the mental health aspect. We know we're in a period of uncertainty, and impact of change creates anxieties, which is mentally challenging. Including mental health support strategies are important for companies to adopt to enable the answering of questions to those individuals that need those answers as, at the first opportunity, that without those answers alleviate and cause stress and anxiety. So there's a lot placed on the leadership of today, but all of those are important for businesses to thrive successfully.
So we know that WorkSafeBC, when phase 3 was announced after the Victoria Day long weekend, they issued guidelines for different workplaces to compose their restart plan. Even at the Surrey Board of Trade, we did ours and posted it on our website. For manufacturers and food processors, can you provide some guidance or advice or your perspective on what should be included in their COVID-19 safety plan?
Certainly. So there are 6 steps to putting your COVID-19 safety plan together, and it starts with assessing the risk at your workplace of where transmission could occur. So looking at the number of people and composition, so whether or not people are living together through community living circumstances, or whether they're traveling to work together in transportation. All of these things need to be thoughtfully considered when conducting your risk assessment. You then need to consider and move forward with a site inspection. So walking through together with your workers on where and how people interact and in common places throughout your workplace, the type and duration of that contact for tasks or conditions, and then obtaining feedback from workers on ways to control exposure. Identifying where the risk of transmission is introduced and how to minimize from exposure due to fluid transmission, the coughing and sneezing, or touching a contaminated surface. So that is the first step. We then need to look at implementing measures to reduce the risks. So things like hygiene and sanitation, where hygiene is washing your hands and removing the virus, whereas sanitation is killing the virus with a proper concentration of alcohol. And then looking at where you can maintain physical distancing in your workplace. Where you can't, you deploy, the interventions such as hierarchy of controls, which I shared earlier in terms of the importance to be able to apply. So always looking at, the start, at the very beginning, looking at, are there ways to deploy elimination or substitution, and then moving into the engineering or physical barriers, which really are physical changes to the workplace to isolate workers from a hazard. And this provides an example in a food processing environment where they do need to be closer together. You can't meet the 6 feet or 2 meter distance. So they have deployed sheets, down within, dropped by this, from the ceiling to be able to have that barrier. Another example of an engineering control, and we've seen it many, as we visit stores, we see that plexiglass barrier. It's important to ensure that the plexiglass barrier, where installed, that it is effective, meaning that it does certainly protect the areas where that point of entry of that virus could occur. So that, the face area, the mouth area. And this is an example where certainly it ensures it manages and enforces that 2 meter distance. A second aspect that has come to light and more recently, and it's now available, it is included on the WorkSafeBC guidelines website, is ventilation. So where you can increase air supply and exhaust ventilation, do so. It does lower the risk of COVID-19 transmission inside a building. It increases airflow and enables effective ventilation, which is also a healthy practice in your workplace. So the next form after engineering controls is really looking at administrative controls. So it's changing the way people work to mitigate risk that include things like training and education, policy changes, safe work procedures, and practicing good hygiene. So having reminding posters on how you wash your hands, wear sanitizer stations, all act as signals for us to change our behaviors to do these more frequently. And this is all part of the implementation of managing the risks through measures to reduce that risk through these controls. When you look at the last form, and we've probably heard a lot about personal protective equipment, it is though the last lines of defense, placing a barrier between the person and the hazard. So in the context of COVID-19, based on your specific risk assessment, PPE should be used where social distancing cannot be achieved, or hygiene stations impractical as examples are outlined in your risk assessment. So those are the first two stages of the guidelines that in terms of the steps to put your COVID-19 safety plan together. We then move forward with developing policies. So with that, we're looking at policies, for example, for visitors or authorization of workplace access, pre-screening of workers and monitoring, illnesses arising at the workplace and notification processes. So these all incorporated in your policies, and then looking at safety procedures for workers off-site or alone. And then, of course, a self-isolation within the workplace policy. So anyone with COVID-19 symptoms, you need to ensure that you self-isolate for 10 days. And of course, those arriving outside of Canada, must self-isolate for 14 days. So from developing policies, you have communication plans and training. Everyone entering the workplace must be trained on the policy and processes within the safe operation plan. And we need to, again, remind ourselves through signage and occupational limits, hygiene practices, and then adequate oversight. So your program isn't effective if you're not following what you've put in place. So really important part to ensure it's communicated and then followed and then monitored, which is step 5, monitoring your workplace and updating your plans as needed. What you think would work well on paper might not work well in practice. So you need to adjust and modify, your program so that it certainly is followed. Consult your Joint Health and Safety Committee. They become advocates and extension of supporting the outcomes of your plan. And then last but not least, in your 6th step is to assess the risks arising from resuming operations. If you haven't been in operation, then you need to look at, are there extraordinary or different risks that you need to consider before you begin starting back to work. So those are the steps that you need to consider in putting your COVID-19 safety plan together.
Lisa, this fall, it's cold and flu season. A lot of the symptoms look similar to COVID. What's the best way to conduct an employee wellness check, and should it be done? How often should they be done?
So in really looking at that, certainly it's an important part of your program because it is the entry point or potential entry point for that virus to come into the workplace. So the advice from the Vancouver Coastal Health Medical Officer that came on our webinar earlier this year was that it needs to accompany a broader program. It's not just temperature monitoring. It really needs to include a series of questions, in addition to, the consideration of temperature monitoring on a regular basis, of asking those questions prior to having individuals enter the workplace. And it really depends on the risk level. So you need to consider things like, employees returning for vacation, for example, have they visited, have they come from outside the country? And are we assured that they are meeting the 14-day self-isolation parameters? Because you don't want them coming from the vacation, perhaps outside of the country, and then back to the workplace. So these are part of the questions that you need to put together in a pre-screening program that really assesses the risks based on your organization.
Lisa, just one question related to that is, do employers and employees, even apart from manufacturing, need to be worried about privacy related to employees when they're doing this testing, the temperature testing or wellness check? How far can it go, without compromising an employee's rights, for example?
No, you definitely needs to be, sensitive to what you can and can't ask, and you need to, follow all the legislation around ensuring that you are doing your due diligence around that, but really including questions that is asked of all, that you're not discriminating a particular group, you're doing it in a way that supports the well-being of your program, together with consultation from the Joint Health and Safety Committee, and all being on board on this. From our experience in working with manufacturers, we've seen that, really it has been a joint, decision from management and the Joint Health and Safety Committee and workers to collaborate on what those questions are to support a good program around the pre-screening process. So certainly ensuring that you're following, all the legislation around that, but it is a healthy part of the process to ensure that you are doing something to prevent the opportunity for those that are, potentially more at risk and bringing that into the workplace, is answering those questions, and if they are sick, to stay home, because that's the fundamental expectation, is not coming to work when you're feeling sick and you're symptomatic. So it's really important part of the program.
So let's talk a little bit more about PPE. And so when you're on that manufacturing floor and you have your plexiglass barriers, what role does personal protective equipment like non-medical masks or gloves play in preventing COVID-19 in the workplace?
So, as I mentioned, PPE is considered, one of the last lines of defense, placing a barrier between the person and the hazard. So, it should be considered as the last, means of utilization, where social distancing parameters cannot be deployed. And if they are required, you want to make sure that you have the right PPE and potential substitutes of equal or greater effectiveness, and know the limitations of what that PPE can do. So recognizing that masks and face covering, they have a role in reducing the quantity of droplets, from being emitted, but does not prevent infection. So I think it's really important to understand that they aren't a particulate filter. They are face covering, in comparison to, for example, an N95 mask, which is 95% effective at preventing, the biological viruses from entering the mouth or in the nose area. So that it's really important. It's an important part of your program, but it's also important to know the limitations. You also need to know that if you include it in your program, there are parameters around that, training protocols, fit testing for those where respirators are required, maintenance, cleaning and replacement. All are part of including personal protective equipment from the, within your program. So you also need to consider, when you're adapting that to your COVID-19 safety plan, to secure a reputable supplier and ensure that you have the quantities you need with sufficient lead time. So all are part of the thoughtful inclusion within the incorporation of PPE within your COVID-19 safety plan, within your process at work.
Lisa, Dr. Bonnie Henry She says there's still a lot of unknowns related to COVID-19. We're still learning about this new virus. What lessons are we learning about the virus that will help us protect our workforce now and into the future?
So this pandemic, as you've shared, has changed the workplace of today and practices that will carry over to tomorrow. So the value of health and safety and protecting our workforce, our impacts, impacts our priorities, both in business and our communities. So some of the lessons that we're seeing emerging and still learning, as you alluded to, is the culture and leadership playing key roles in building trust with workers that shape and the ability to pivot and adapt quickly to changing or unknown parameters in the landscape. The importance of education and knowledge and keeping everyone informed for effective decision making on changes when they occur and why. The importance and impact of mental well-being, as I mentioned, and how to integrate mental health strategies to support positive outcomes. And just the importance of building a resilient workforce that is able to thrive within a changing environment. I can't underestimate the importance of communication, and we're hearing this over and over at all employee levels, both within the virtual environments that we're faced and on site in the business environments. That is becoming a key fundamental foundational lesson for all of us that I hope that will carry forward into our world of tomorrow following this pandemic.
Well, you talk about communication. How, in an ongoing way, can we ensure that employees understand our policies and procedures for COVID-19 and how to limit its transmission in the workplace?
So, when we look at communication, absolutely. So ensuring that, training and you're reviewing the policies and procedures, both in groups and in individual, because you will have individual questions that are personal that individuals will not feel comfortable in a group setting to share. So you need to offer both opportunities and strategies to ensure they understand the why, because that is so important to changing, the behaviors, or ensuring that they follow those behaviors. If they don't think it's important, it's less, there's less likely, or you tend to have those gaps more frequently of not following process. Connect meaningful scenarios that are employee centric. The impact of not complying could impact the safe and well-being, not only at work or your peers, but your families and your friends. So I would solidify that relationship when we're talking about, implementing your COVID-19 plan, monitoring for effectiveness, again, in application. And really, my recommendation is to include it as a standing item on your Joint Health and Safety Committee, because it brings it up every time. And most often you'll find some changes that need to be made because it's just not working. So I think it needs to be real and alive and breathing within your business framework. And you have to address the challenges as they arrive. If it's not working, you got to find ways for you to strengthen those controls, together with information and discussion around the workers and the management discussions.
So for the manufacturing and food processing industry, and really this next question applies to all businesses, but it's very challenging for this sector to be able to work from home in order to do the work that is required. What is the best way to prepare for a potential second wave of COVID-19 this fall?
So, that's a great question. When you look at Dr. Bonnie Henry's address in earlier this year, it's not a matter of if, it's a matter of when, because every former pandemic has had a second wave. So, preparing your business for operating effectively under your COVID-19 safety plan is certainly a recommendation, including a strategy to prevent, complacency. We need to remain vigilant, incorporating inspection processes that include observation of behaviors, everyone, following the protocols every time, designing communication processes that include engagement opportunities from the workers, including a process that allows everyone to freely ask questions openly as well as confidentially. As I mentioned, there'll be personal questions that create fear, and they need, understanding the rationale for those fears through questions and answers, and garnering knowledge, I think are really critical. And then secondly, review your plan and consider strengthening controls as we move forward into the flu season, which, the fall and winter time, including your COVID-19 safety plan as I mentioned, as a regular review by our Joint Health and Safety Committee. Keep it on the top of the agenda, because as we know with businesses, where it's on the agenda, it's apparent that you will be working and actively, addressing those controls on a frequent basis. Review your patterns and trends in the community and organization as well. Are you seeing outbreaks in your community? What is the risk level in your organization as a result? Workers are living in the community and obviously frequenting locations and retail stores. So it adds a layer of opportunity for you to strengthen your controls when you're seeing those trends happen. And then thirdly, develop a plan for managing a facility or community COVID-19 outbreak. I am recommending that you prepare, you understand what happens, develop a plan on how your business would be prepared to respond if you would have an outbreak at your facility. Consider the communication processes, internal and external, documentation, review, input from workers. Define the parameters of what you can control versus what you can't, and how would you react. Preparation is key, and it really helps your business be able to be prepared for an effective response, just as you would with preparing for in the event of a fire. Consider this in the same thinking. We had again, a webinar with Dr. Schwant, the medical officer with the Vancouver Coastal Health. He provides really clarity on the overview of what happens during an outbreak, the contact tracing and such, that I'll include it as my package of resources for your members and participants today to walk through that, because I think it's really important to understand what happens so that you're not, if it does happen in your facility, you're not surprised. You are prepared for that knowledge, and knowledge is valuable for helping your businesses be prepared during a circumstance that is somewhat out of your control at times.
So Lisa, you mentioned that with your COVID-19 safety plan, and I also said this to my staff when we reopened our office, that it is a document in motion, and it needs to be agile, it needs to be flexible. But some employers we're finding are not incorporating or building or composing their safety plan. But they need help. Where do they go for help? And other questions where things are a bit challenging for different industries.
No, absolutely. And our organization is one of those organizations serving the manufacturing industry. We're one of 13, and I'll share my screen because it'll give you kind of the visual of the opportunities that are available to businesses within your community and within BC to be able to support the opportunity to reach out to us. And really, we would like to help support your success. That's why we exist. We're a health and safety organization here to help you build your plan, strengthen your plan, any questions that you have related to health and safety to protect your people. There are 13, as I mentioned. Here are brands of all of them in British Columbia that serve a wide variety of sectors and are there to help support you in putting your plan together and answering any questions. We've put together a number of resources, and training products are available. And again, as I mentioned, I will forward them to you, Anita, to share with your members on, a checklist of the how to put a plan together. If you're struggling, I invite you to contact us. One of our advisors will meet with you virtually and have that conversation, through shared screen support. And it is confidential support, so please know that. We're here to enable your success. We have a team of advisors. We have a professional team in a number of different areas of specialty. We have an occupational hygienist whose expertise resides in, understanding particulates and contaminants, and just the level of knowledge around personal protective equipment is a lot. So, please, we invite you to connect with us to get your questions answered. Again, this is an example of a COVID-19 safety assessment that you can walk through and see whether or not it's you are in a position to open safely. There are all kinds of other resources that we're including, around mental health, as I shared, is a really important aspect that you need to consider within the processes of within your business. We know that the mental component is an important component of it's not just a physical that we want to include when we consider the well-being of an individual. So here are some links and additional links to support you. Again, you look at free virtual counseling, through the COVID-19 psychological first aid service. So really valuable links that will enable businesses of all sizes to access. And then, of course, WorkSafe has industry-specific contact in terms of specific areas that reach all sectors as guidelines and information. Again, and they are emerging all the time. One of them, as I shared, is the recent information on ventilation. And of course, I mentioned about Dr. Michael Schwant and Vancouver Coastal Health. It talks about, really the medical parameters around the outbreak and contact tracing and all of those really important components that you need to be aware of. Because quite often, and from the leaders that I've talked to that have been through an outbreak, there are always surprises in what happens and in the process. And if you can avoid some of those, it helps you prepare, which is valuable. So, really all of this is available to you. So please use it, please reach out, and we're more than happy to help support your success and answer any specific risk or related health and safety questions for your business.
Lisa, a question from the audience is, how do you see new technologies for sterilization of work areas coming into play in the future of manufacturing workplaces, such as UV, disinfecting, lighting?
Yeah, no, we are certainly seeing them emerge. So one example is through the HVAC. I know that there are companies that are partnering with other companies to be able to strengthen, those sterilization, within the ventilation systems, and just in, for example, hand washing stations. So, they are emerging. And they are being promoted to help support with the controls and necessary controls to to help protect the people.
So the Surrey Board of Trade, we've always advocated for a strong and robust manufacturing industry sector, not only within Surrey, which is going to be the largest city in British Columbia very soon, but within Canada, because it creates those good quality jobs and that really support the livability of our cities and for our nation. Lisa, just from your perspective, since your organization focuses on manufacturers and food processors, what is the future of the sector when we're dealing with this type of a virus?
Well, certainly we want to see the manufacturing community, emerge from this situation, healthy and able to adapt, especially as you mentioned, to the new and emerging technologies. With the new technologies is coming emerging risks. So our role is helping support companies successfully in managing that risk. And I'll give you an example. Several manufacturers pivoted to support the communities and other sectors during this pandemic, switching from, for example, distilleries to manufacturing sanitation or sanitizers. But with that emerged new risk of just knowing that, with a highly based alcohol product is flammable, right? So you look, you want to make sure that those risks are managed in that adaptation. You're not having, you're storing effectively so that doesn't add other, the potential for explosions and combustible related outcomes. So, our role is partnering with industry as they evolve with the new technologies and adapting and growing the manufacturing sector across Canada, is to support them through programs that address these new risks that emerge.
Do you have any closing remarks?
Well, we are in this together, and our role is partnering with all, within our province and beyond to support your success. Certainly, we want to continue to be available to help support you wherever we can through this pandemic, providing advice on health and safety, and partnering in delivering effective solutions that meet industry's needs. Quite often, we find what we come up with or identify doesn't work, and your feedback from industry is a critical element to support that collective success or outcome. So, I thank you, Anita, for inviting me to be part of this panel today, or this event today, so that we can share, knowledge and information to support industry, and that together we emerge successfully from this pandemic stronger than ever.
Well, it is all about collaboration, partnerships, leadership, and new ideas as we navigate our way through this pandemic. We're all in this together, as Dr. Bonnie Henry continuously says. Thank you, ladies and gentlemen, for spending some time with the Surrey Board of Trade and the Manufacturing Safety Alliance for BC. Make it a great business day.